Many people will agree that eyebrows play an essential role in general beauty of the face. However, not everyone is blessed with perfect eyebrows. This results in feeling of unhappiness on the appearance of their eyebrows. The Epiderma Clinic eyebrow enhancement procedures can be a remedy for this situation, and you're considering an eyebrow transplant and have questions about the procedure. Here is a list of FAQs, that is question and answers, that will help you understand about eyebrow hair transplant. Welcome to our podcast channel, Epiderma Podcast. This is Dr. Abhilasha MD, your host with you. In today's episode of podcast session, I'm going to talk to you about frequently asked questions about eyebrow transplant. First thing is, how long does the procedure of eyebrow transplantation take? The duration of the procedure depends upon the number of hair follicles we are grafting or transplanting. Around 200 hair follicular grafting should be over in 2 hours time. So what are the side effects of eyebrow transplant one can expect? Post-procedure, one might experience pain in the donor and the grafting area, and crusting will happen in few days, and old hairs may fall as a part of healing. In few days, hair from the grafted follicles start falling. By following the do's and don'ts, one can handle the aftercare procedure. Can anyone identify about the hair transplantation? The extracted hair follicles are grafted in such a direction that it matches the other hairs in the recipient area. Moreover, the hair follicle selected for grafting needs to fulfill two important aspects. The hair follicle considered for grafting should have characteristics similar to eyebrow hairs, and secondly, the direction in which the extracted hair follicle is grafted. Post-recovery, the new hair grown in the eyebrow area is natural and looks very much similar to the original eyebrow hair. Except the patient, none can make out about the procedure. They will only notice the enhancement in the facial features and compliment the person. What is the post-procedure do's and don'ts? The details are as follows. Dressing is done in the donor area for about 2 to 3 days. The grafted area is kept undressed for faster healing. Don't fiddle with the bruises or the grafted area due to itching or paining. Sterile wipes should be used for wiping or cleansing the face except the procedure area. Scalp hair wash should be done based on dermatosurgeon's advice. Advised medicines should be followed. In case of persistent pain or itch, report the counselor or the clinic for the review consultation schedule informed by the dermatosurgeon. Hope this podcast episode helps you. So that's all for the day. We will keep it short. For any queries, don't hesitate to talk to your doctor because you have every right to know about all the options before you start your treatment. For free resources and materials, head over to www.epiderma.in. We look forward to having you join us again next week for another exciting episode. Thank you so much for listening, and it's me, Dr. Abhilasha MD, signing off.